right, so today we are going to work on an interdisciplinary collaboration project, and we're just going to have a little casual conversation about non-dental healthcare professionals and their role with dental. And today we have with us Bruce. So Bruce, go ahead.
I'm a 39-year veteran of ICU. I've worked ICU primarily since I graduated from nursing school. I don't do a lot of close work with dental patients. They don't fall into our category. There's a very limited role right now where we use the dental as a diagnostic tool. Basically, if the patient's coming in CHF, has cardiac problems, we will look at dental health as something that could point us in another direction, such as a pericarditis, endocarditis, that area. But other than that, no, we do not really focus heavily on dental problems.
All right, great. So if you could maybe just, you did seem to do it pretty well, but maybe you could describe your clinician role in full as a nurse.
Well,
especially now during COVID.
My clinical role as a nurse in ICU is obviously we follow the nursing process assessment, planning, evaluation, and implementation. It's highly critical role. We deal with most of our patients are either severely ill or ventilated at this stage. They are generally shorter term stays. We basically stabilize them and move them along. Sometimes the stabilization will take weeks to months, but that's basically what we do.
All right, great. Thank you so much. Especially talking about the assessment, planning, implementation, evaluation. We use that a lot in public health. You already kind of stated how you view your role working with a dental professional by saying you don't. So we'll move on and maybe ask you, how do you view oral health? And how do you view it in your profession?
Well, it's very limited with oral health in our profession. We do, with our ventilated patients, we do have a very planned oral care with our ventilated patients. They do get mouth care every 2 hours. They get their teeth brushed with a chlorhexidine preparation every 6 hours. Oral health in that respect is very important. It's basically what we're trying to do is maintain the normal pH in the oral cavity, and it's more for prevention of pneumonia and all around cleanliness than anything else.
Right. Just curiously, chlorhexidine, obviously we use that. You talked about the importance of keeping the pH of the mouth at a neutral area, and I'm sure you guys have maybe received some CEs in that way as nursing professionals, but was there a specific product you guys use for that? Or?
Well, there is. We have a kit that is a 24-hour kit. It involves obviously 12 different instruments for cleansing the oral cavity. Also provides a biotine rinse at the end to kind of maintain that pH and just a nice clean area, a nice clean smell.
Great, thank you. You already said you don't really collaborate with dental professionals, but the question does ask, describe how you would collaborate or how you collaborate with a dental professional.
Well, unless in the ICU role, it's very rare that you have a major dental emergency that is going to involve bringing a dental person in, unless it's a multiple trauma. And unfortunately, I don't work in a major trauma center, so we don't get those types of patients in the ICU. That would be more of a role that they would have in the emergency department, where you would come in with a specific dental problem. They would do an oral evaluation at that point. We don't do that in the ICU.
No, that's actually, it seems to me so far that the nurses with the limited oral training, and it's not specific to that you guys take a more preventive approach in the ICU with the disinfectant and keeping the mouth at a neutral pH rather than a more reactive.
It's not so much that we're working with the oral cavity as it is. It's prevention of ventilator acquired pneumonia, and it's something that is mandated by the state. So it's not something that I think all healthcare professionals really deal with, but it is something that we do. It affects the patient's stay. It affects good outcomes. So yeah, it is something that we do on a regular basis, and it's incorporated into our care. It's part of our care. It's what we're taught to do. It's what we do.
Great. What barriers, if any, are present during your communication, if you have any, with a dental professional?
I'm sorry, can you repeat that?
Yes. What barriers, if any, are present during your communication, if you have any, with the dental professional?
We have very little contact with dental professionals in the ICU. Like I said, there's very few dental emergencies in an ICU where we'd require a
If there
dentist.
was a dental emergency, who would you contact? Would you guys go to the emergency room, or would you contact a dental, like if you could assess that it was a dental related emergency? Who would, that's the next question, is what solutions are available to overcoming a barrier? Do you guys have like a dental professional, like a maxillofacial surgeon?
We do have access to ears, nose, and throat. We do have access to surgeons who would come in, but that I deal with the critical part of things. Right. That is usually something that's taken care of when they're moved from the ICU.
Okay. Yeah, it would.
It could be surgical. It's very unlikely they're going to do surgical while someone's intubated. Right. Just basically because of the location of the ET tube, everything else that's involved in that part of their care. In a primary care hospital, it's not something that we tend to really focus on. Its focus on is the critical aspect of their illness and not long-term solutions.
Is there anything else you would add in relationship to oral health care providers and your clinical role?
That's a tough question. Like I said, our focus isn't oral health. Our focus is general health and critical recovery. So at this point, I would probably say no, not in my role. There is a definite role within the hospital setting, but not in my role.
All right, thank you so much for your time.
You're welcome.